Let your left shoulder relax as well. Solid! Come on over. Pushes first. There's the spot. Okay, beautiful. Right here facing that way. All the way. Woo! Nice, buddy. Hey everybody, Dr. Bain here. Got another video here. I got one of my patients, Chris. He's got a super cool case. I treat a lot of complex cases. So Chris has a fusion and a cage down his lower spine, his lumbar. So he's got a lot of issues, a lot of limping, a lot of daily pain, pretty high sometimes, usually like anywhere from a 6 to a 9 or 10 out of 10. So I'm going to show you a visit how we treat somebody who has a cage in their lower back. Okay, Chris, so pop your shoes out. Come on over on this side here. And actually, you know what? Let's get a picture of posture today too, because I want people to see the changes there. So let me have you stand right here, facing that way for me. I'll pull up my camera. Okay. Okay, so take a nice deep breath in. Let your body slouch, just let it collapse. Perfect. So everybody at home there can see a lot of the slouch that Chris has going on there. Okay, so come on this side for me, Chris. So let's just see what we find. So people with fusions tend to have a lot of that scar tissue that we always talk about. So why is that? Well, those fusions don't allow your bones to move properly. So kind of like a screw that builds rust after many years, that's kind of what scar tissue is when you have fusions. Okay, so look down towards the floor, look straight ahead. I'm going to check him here for scar tissue first. Look down, straight ahead. So a lot of that is what we do with him, is we're doing a ton of scar tissue work on him typically. Look up, straight ahead. And we may never be able to get a fusion person perfect. Look up, straight ahead. But we can get them pretty darn good in comparison to where they used to be. Look to the right, straight ahead. And here we go. Look to the right, straight ahead. Yeah, you already knows it's coming. Okay, so scar tissue piece. Okay, sit right there for him, Chris. Yep, so this is a lateral piece of scar tissue. He's kind of an old pro at this one by now. Because he's got a lot of these pieces. So, okay, so let this just nice and loose. Relax your body. So really essential, patients relax for this. So remember, this isn't a neck thing, guys. This is a scar tissue removal. Okay, nice and relaxed. Good. Let your body slouch. That's it. Let your shoulders relax a lot more. Good. Even looser on your right side. Good. Let your left shoulder relax as well. Solid. Come on over. As I tell every patient, those never get old. No matter how many you get. But look at this. Take a deep breath. Look how much his posture's already popped up. I mean, look at that. Chest collapse is way down, breathing's way up, head is already way back, shoulders are way back already, all from just removing one piece of scar tissue. Look to the right, straight ahead, good. And he can move further, which is awesome. And that's gone. So, now I'm going to get on to bones here. So first bone of the day here, it's going to be C7, no surprise. I'm going to fix his second rib here, relax your shoulder. Good, that moved easy. Same thing here. Oh yeah, okay, back right there. So we're going to do the first rib chop. Let's come around this way here. So we're going to do first rib chop here. So first thing I'm going to check here is to see how tender he is. Not really, right? Yeah. So that just makes sure that that second rib stayed in. Relax your shoulders down. So we see we've got a nice bit of shoulder slouch here. So remember, when we see shoulder slouch, it's not the shoulders. It's the first rib that sits behind the clavicle. So we're going to fix that with the first rib chop. So nice and relaxed there. There's one. There's two. Now I'm going to fix his C7. There you go. Shoulders relaxed. Okay, so I got to come all the way up here. So C7 is one of the most important bones that I fix, because it's the number one reason people get that head stuck forward and slouched. There's that right there. Okay, shoulders relaxed, just look straight ahead. Whole time. Okay, a couple small pushes first. There's the spot. Okay, beautiful. Right here facing that way. So it doesn't take much. And look how tall he is now. Can't stop him. Yeah, he's super tall, his breathing's much better, but we still got a ways to go. He's got some other things going on here. Namely, from what I'm seeing, T2. So same thing, different spot. That's it. Shoulders now relaxed. I'm going to get a little pressure first. And slowly relax your head down. See, and that bone moved before I even pushed. So a lot of people are hyper-focused on the cracking. That ain't the thing. Yeah, it's entertaining, it sounds nice, it's cool, might even be satisfying. But for me, it doesn't matter. All that matters is did I feel that bone shift in the proper direction. And it was super easy. Now he's got another one right here. Back right there for me, Chris. Okay, cross your arms there. So I'm going to go way down here for this one. Let your body looser, and that's it. Good. So I'm going to change the angle. Let your body slouch a little more. Let the head come down. And there we go. So if you'll watch a lot of old school chiropractic, a lot of these guys are just really pouncing on their patients trying to get a bone to move. Well, if you push more forward, right, if you push this person in the wrong direction, which would be more forward like we do the old way, the body's going to resist that. So these guys are pouncing on people all the time trying to get these bones to move. You're working way too hard. You don't have to do that. Just like that, all you do is you change your angle a little bit. And as long as you push these bones backwards, very simple, very easy, they don't fight you at all. Okay, so now we're into his lumbars. So we're not quite at his fusion yet, but we're getting close. Right now we're a couple levels above his fusion, and no surprise, he's got one right here. So I'm going to have you sit right here in the middle of the table there, Chris. Feet on that side for me. Okay, and then scooch back just a hair. That's it. Cross those bad boys. So now this is a pretty important one for him because now we're getting close to the fusion. So relax these feet, let them fall to the sides. Good. Tuck your chin down. Let your body go limp all the way. Woo! Nice, buddy. Like I said, it's not important. I'd like to say I'm not a crack addict as well. I do like when it cracks, but it doesn't have to. Okay? Chris likes it better when it cracks too. I think we all do. Yeah. But it's a bad habit. Okay, it doesn't need to happen. It's a false sense of security that you did something. Okay, because a lot of times when it cracks too, sometimes it means you did the wrong thing, right? So it doesn't really tell you a whole lot about did you do this right or wrong. But it is nice. Okay, so that was about L1, 2. Now we're getting down into the nitty-gritty. So now I'm actually checking his fusion. So a lot of people think you can't adjust the fusion directly. Yes, you can. But you can't do it the old way. If you adjust a direct fusion the old way, you will make that patient worse, period, because you will push them more forward and it will mess them up a lot. With ABC, it's not a big deal at all. In fact, it's necessary. If you skip it and it needs to get done, that's when you actually get problems. So sure enough, I have to do his L4, which is part of his fusion. So sit right there, feet that way for me. Good, okay. Cross your arms there. So now this is the toughest one for him. So essentials, of course, always relaxed on the legs, tuck that chin. Let me have your full body weight, and let's just make this quick and easy. Good. And it actually moved. So that's the thing. It's fused, but the surgeons fused his bones in the forward position. This is why he has so many issues. If he had seen me previous to the fusions up, which wasn't possible at the time, right? But if he had, he never would have had the fusion done in the first place. The problem is the surgeons fused his L5 and L4 forward. So the interesting thing though is even though it's fused, we actually moved it. It's movable. And thank God for that, because if it wasn't movable, he'd be in a lot worse shape than he is now. Okay, so now I'm checking his sacrum. Very nice. Okay. Nice. Check his femurs here. Okay, so he's good on those, so let's work on your feet. So, lay on your back for me, feet towards you. There we go. I think Teresa's right, I do look a little Miami Vice today. Okay, there. So, just gently working on the feet. Feet get just as many issues as a back does. So you just gently move it in the ways that your body can't do on its own. That's it. Beautiful. Just pull the toes. Beautiful. Next thing here, going to push up all the vertebrae in the bottom of, or vertebrae, all the bones in the bottom of his feet. So these bones in the feet, as I tell everybody every time, these bones get stuck down, which causes plantar fasciitis and flat feet, so you got to address those. You can't skip them. His navicular especially is a little stuck on this one. Ooh, that was awesome. Okay, now I'm going to address his fibula here. Nice. So that was easy. Same thing here. Beautiful. Okay, come on this side for me. So now I got to recheck everything, because once you do the legs, a lot of stuff can happen. So I bet Chris will tell you he's a little fuzzy-headed now.
Yes.
Okay, how did I know he was fuzzy? Because it took him longer to get up, and he made a little swaying when he got up. Why does that happen? When you work on the feet, sometimes it knocks out a vertebrae in either the upper back or the lower back, which then causes the spinal cord to get tight, which pulls in his brain, which then makes him fuzzy and kind of weird for a sec. So now I got to figure out which bone fell out of place. Or which bones, I should say. There could be multiple. So I'm going to recheck his lumbar again to see if that one's the one that came out. And of course, the L4. So I got to refix that same L4 I did earlier. So come on over, feet that way. Good, cross the arms there. Good. Tuck that chin, let your body go really limp. Yep, little shift, didn't take much. It was already mostly where it needed to be. Okay, good. You can see he got up a little faster. He's probably still a little fuzzy, so that means probably got to fix something in his upper back. But you can see his posture already started to pop up again. So I'm going to recheck C7. Nope, that's fine. I'm going to recheck that T2 I did earlier, because that's a pretty likely one to fall out of place again. Sure enough, it is the T2, so that's why he's still a little fuzzy. That's it.
Shoulders loose. Slowly let the head come down.
And a little click. Beautiful. Okay, now let's just see where he's at so far. So take a deep breath for me. Man, that's pretty dang good. Okay, we're going to do a couple lifts on his ribs, just see if that takes care of that little slouch he still has. Nice and loose. So little rib lifts like this, they take care of little bones that are stuck forward, okay? Take a deep breath. And look at that. So now he falls backwards. It looks really nice. I'm going to check one last spot, because I'm a perfectionist. I can't help it. I'm going to check right down here. There's a little guy right here, so that's why he has just that little slouch right here going. Last one to fix here, then we'll get a picture. Okay.
Shoulders loosey-goosey. Let your head and body fall. Good.
That's all it takes. Nice deep breath in. Oh yeah. Beautiful. Okay, let's get a picture of you. So, stand in that same spot we started originally. So right about there, facing that way. I'll pull up the camera here. Okay, nice deep breath in. Relax. Beautiful. Awesome. Let me just check and make sure there's nothing else I want to do. Oh, that's really nice, Chris. Okay, so we'll pull him up here. So let's take a gander. So, Chris's pattern is really interesting. So you can see how his pelvis, he's doing what I call the Elvis pelvis. He's sticking his pelvis straight forward. He's losing all of his butt because of that. And he's doing this leaning back. So he's really swaying back like this to try to lean and, himself and compensate for the forwardness that's happening here. So you can see his chin's a little jutted forward, his neck got shorter, and his shoulder and chest are collapsed. That's why you can barely see his chest here. So that's his first picture. Nice. Look at that. Chest is up, shoulders are up and back, Elvis pelvis is gone. Little butt starting there, right? Look at that, no booty. Nice big booty, wow, look at that, huge. He gained like 5 inches, man. That's crazy. So yeah, he's no longer doing the Elvis pelvis. His pelvis is actually straight across now. You can see how much leaning back he had here with no curve in his lumbar. You can see a little curve starting to begin here. He's no longer leaning back as much. And then you can see here how forward his chin is jutted because you can watch his beard. And you can see how much his beard and head suck straight back, and his neck actually gets a lot longer. And you can see some pecs starting there. Look at that, no pec there, baby little peckies. Look at that, massive pecs already in a couple minutes. That's awesome. Now he's got pecs and a butt. So, so if you guys are more complicated, or if you're more of a simple case, right? So if you have fusions, laminectomies, things like that, discectomies, I work on them all the time. We get people very, sometimes totally asymptomatic or very close. But even if you're a regular average person, the results are incredible. ABC is really the future. We can't be doing this the old way anymore, which is why I make so many videos on this stuff. We have to be showing that our results can be so much better and that you can get long-term correction for a lot of people. All right, guys, I'll post some pictures pre-post here at the end of the video. I'll see you soon.